Hi, I'm Beth O'Brien, and this is Career Profile number 2. I had the opportunity this week to speak with a marriage and family therapist. He works for Hazelden. Their tagline is Saving Lives and Restoring Families from Addiction for over 60 years. This is a well-known and respected top-tier inpatient treatment agency for drug and alcohol abuse. They have centers throughout the nation, and he works in Newberg, Oregon. The contact that I spoke with was Mike Olson. He described the working environment. He said this is a national agency, a residential treatment center. It was for on-site drug and alcohol counseling. The patients would come in for anywhere from 28 to 90 days for treatment. Each individual patient had the potential to receive care from primary dependency counselors, psychologists, family counselors, wellness counselors, spiritual counselors, and medical doctors. They were all available for the patients. His role in that team was to be a family counselor. He works from 8 to 4:30, so his hours are set. He talked about how there's not a whole lot of flexibility within that. And every couple of weeks, they have family week where the families would come in for education and training to help support those who are struggling. And during those weeks, he said he worked a great deal more than 40 hours a week. The agencies, he said, when you work for an agency, it's not particularly family friendly. Particularly working for a county agency, it's not at all family friendly. But there is a lot of personal time off for mental health days because there is a recognition of the potential for burnout. Mike, in particular, does a little bit of private practice work on the side, and ultimately that's what he's working toward, being able to do private practice, full-time. He said this is much more flexible and makes family time a lot easier. He said you can work for 150% more income for about 75% of the hours. So 4 days, 6 to 8 hours a day, with a lot less bureaucracy. And also that in his experience, what he's doing now is that he does private pay, which means he doesn't have the hassles of insurance. He said some of the typical stressors of that job would be to take on too much, taking it personally and not being able to establish those boundaries for yourself about when the work ends and when your home life begins, because hearing about people's traumatic lives can be a difficult thing. People's heavy traumatic experience, he talked about transference and how that can be really hard, draining, and exhausting. He also talked about the paperwork. He said working with insurance is particularly difficult, that there are very precise documents, or if you don't fill it out right, you don't get reimbursed. He also said it was difficult to translate people's personal experiences into money making. Having to articulate to the insurance company how and why a particular treatment was needed was a real challenge, and that was something that was new to me and very interesting and informative to learn, that having to take people's personal experiences and translating them into something technical is a real challenge that he described. He also said that those insurance companies will do reviews about every 3 days, and at any time they could pull the plug. They could take the funding for that particular patient. So it becomes difficult to make the best decision with the patient as the foremost priority, when instead sometimes you have to consider what the insurance company is going to cover and what they're going to say, and you make treatment decisions based on those things. That he described as a real challenge with what he's doing right now. He said sometimes it can feel a little bit like blackmail, and I hadn't considered that. Some of the benefits: he receives medical, retirement options, and personal time off, as I said earlier. But mostly he talked about how the benefits are helping people. Knowing that listening to others makes a huge difference. He described it as a place of miracles. He said literally you see people who are dead coming back to life, physically, spiritually dead, coming back to life, and knowing that what you're doing is really making a difference every single day. He said it was really easy to find such meaning in his work, that he loves what he does, and that he can literally change lives and families' lives every day. Some common job tasks. He is a family counselor, so one thing that he does in this setting is to contact the family members when patients are admitted by phone and establish plans or educate them or inform them or whatever the case may be. Even more than that, he works with patients directly about their family issues, and so face-to-face interactions, individual one-on-one interactions. He also does group work, processing groups, and he described them as little mini ecosystems, and really enjoys that aspect of what he does. And then, as I said, there's a Family Week program where families will come in for education and treatment as well. He says a lot of what he does is assessments. How are the relationships? Where are you? What do you see as what you need? That kind of work. Deciding what's best for the patients is a lot of what he does. And he described his role as interpretational rather than diagnostic, which he likes. That he can sort of make his own assessments, and that was something that he was looking for in a job. He does a lot of teaching. He said much of what he needs to deal with is just basic communication skills, teaching them and employing them for himself. Does a lot of training and educating. And then finally, he described the clinical coordinating meetings as a treatment team. Again, there are a lot of people available to help those clients, and together they need to have meetings and decide what's best. And he talked about how that's really good, but can also be a challenge. It takes a lot of skill building and a lot of communication skills, effective communication skills, in order for those to be productive and meaningful. The education requirements: he has his master's degree. He said there are many people at that facility that can work with a bachelor's degree and can practice within a limited scope. He said mostly in the education branch of treatment. He talked about how he and many people get their CADC, their Certified Addiction Dependency Counselor certification. This gives people the opportunity to practice in clinic and takes the responsibility for your operation, but you cannot practice on your own. He talked about this and described this as a really great way to gain confidence and competence from his experiences while he was getting his education. The starting salary was from the low 40,000s to the mid 40,000s, and then an experienced salary range for maybe a supervising or manager or mentoring kind of position would be 60,000s. Miscellaneous career information. I asked him what kind of advice he might have to offer. He said, get your hands dirty. He talked about how there's an ongoing discussion in his practice about both the art and the science of therapy, and how the science can be taught. The principles and the logistics of therapy can be taught, but the art is innate. And a lot of people are open and warm, and they get into the field because they want to help people, and because of that, sort of people have always been drawn to them, that kind of thing. But that once they get into practice, they discover that burnout is a real issue and that they may not actually be equal to the task of that work. So he said, get your feet wet so that you can understand your strengths and weaknesses within that kind of working environment. Again, my interview was with Mike Olson, the marriage and family therapist, so he was my information source.